what are some things that patients of color can do, in order to protect themselves from these inequities that you've talked about, starting with diagnosis and, treatment? What can we do? What can patients of color do?
Yeah. So I think the number one thing is to ask questions. The number one thing is to say, what are my options? What am I dealing with? What should I do? What shouldn't I do? And to really make sure you get the most of that time when you see a physician, because that is really what we're there for. Apart from the surgery, I'm really there to be an educator. I teach as much as I operate on a daily basis, whether it be the medical trainees, whether it be my patients. My job is to communicate information back and forth. So you really want to spend the time asking questions and getting as much information out of the specialist as you can. Number two is see a specialist. There's also very good data to indicate that as a Black patient, if you see a board certified thoracic surgeon, you are more likely to get lung cancer surgery than if you were to see a surgeon of unknown specialization, a general surgeon. So clearly the training gives specialists the ability to make finer determinations and discernments that I think in large part favor, Black and minority patients. So you want to find someone who deals with these disease processes all the time, because they're going to look at it at a much higher level and look at it with a lot more granularity.
I just have to repeat what you said. You said, I teach as much as I operate. That just really resonated with me. And I think that that's so incredibly important. Doctor means teacher, right? I think that's the Latin. Yes. So that we are obligated to teach our patients. So I just really appreciate that that's something that you incorporate in your daily practice.